Brilliant. Like I say, Daniel, we are going to go through the start really of this sports massage course today. We have 3 modules that we're going to be doing online, and the remaining modules are going to be done elsewhere for your practical. So hopefully the practical element will coincide with the information that we get, that I perceive to give you on the theory, and then obviously back or forward. So you'll take a lot of people's information, excuse me, and then hopefully come up with your own ethos of how this sports massage course is going to affect you and how you're going to implement that in reality. Like we said, we have 3 modules to do regarding the theoretical side of it, and the rest is the practical side of it. And the first one we're going to look at is professional practice in sports massage. There are some worksheets that correlate along with these. So if you obviously, if you have your manuals with you, then brilliant. If you're not, if you then make a note in your LAP on page 13, there are some questions and answers that need to be done. I think in total there are 12 questions, and there's a 23 pass mark. So out of 33, you need to get 23 to pass. These are done in your own time, but hopefully you will get them done quite quickly, because then you can pass them on to myself. I can mark them, get them back to you, and that's just one part of the course, or predominantly in this module, completed. There are other modules, as we said before. We have 3 that we have to do online, and each one will have its own set of worksheets. So rather than play catch up and try to do them all at once, hopefully the information that is imparted on you through these PowerPoint slides, through the same information in your manuals, but also through the practical element of it, should give you good indication of how to answer these questions. And it's always good to do them quite close to after you've heard something or read something, because it's fresh in your memory. So on your LAPs, page 13, unit 5, professional practice of sports massage. Hopefully we can get those questions done as soon as we can, and then we can get them back to myself for marking. Like I say, if you do have your manuals, you can follow this, and I think it's going to be on page 187. But like I say, if you haven't, then it's not really much of a problem, because like I say, the information that's going to go through on the PowerPoint slides are going to correlate slightly, if not a little bit easier to go through than is on your manual. So the PowerPoint slides will give you a foundation, and your manuals will then add on to that foundation. Any questions so far, Daniel? No, brilliant. So we're going to start this PowerPoint slides, and I say we're going to look at professional practice sports massage, and it's probably an area where a lot of people don't, in my experience in the past, don't really take it with too much consideration. People like to get their hands on, people like to rehabilitate individuals, people like to stop from injuries from happening. But when it comes to the actual practical side of it, especially in the professional practice, there are things that we have to sort of really abide by, because these are our foundations. If we don't get these right, then obviously we're not serving our clients right, but we're not serving the industry well. Yep, the PowerPoint's on. I just flick the first one. So it should say contraindications of sports massage. Brilliant, like I say. So we've got a PowerPoint slide. We have 11 on here, and hopefully before this time's up, hopefully we're getting to another part, and obviously have upload a few more PowerPoint slides on there. But we'll take it as we go first, because like I say, this contraindication of sports massage is very important. There's a lot of information that we need to get through, but it's a foundation. If we get the foundation right, then we're going to treat our clients very well, and we're going to get great results from our massage techniques. However, if we go there blind and just go with our massage techniques, there may be some things that are occurring within the individual that we're not taking into consideration, which may actually harm the individual and cause us problems, but more importantly, cause the client problems. So hopefully by the end of today, the aim of the session is to introduce contraindications to sports massage. And hopefully the objective is by the end of this session, you, which is Daniel, will be able to describe contraindications to sports massage, describe the procedures to follow, and describe the procedures to follow up. So we're looking at really what can we do before we even go into our sports massage. What information do we need to obtain? And if we do find some information, we may have to then refer elsewhere, or we may have to then explain to our client why at this particular moment we cannot carry out a sports massage. So hopefully by the end of this session today, you have a really good indication of, even before you have your clients coming in, You're going to go through some questioning, and you're going to look at a lot of things that regarding their history, pre and post, etc., that allows you to make an informed decision whether carrying out the sports massage or a specific technique at this time is going to be beneficial. Brilliant. If any time, Daniel, you're not too sure, or I go too fast, or there's things that I skip that you want to ask a question, please ask the questions, and then we'll always go back and re-enhance your learning. Superb. So the first thing really is to have a think about what contraindications are. So when we look at among sports massage therapists, we need to understand when do we refer out or when do we carry out the activity of sports massage. Because if we have certain problems regarding the individual, they come with us with certain health issues, then we are going to possibly make those health issues worse, and then maybe even exaggerate those health situations for the deficit. So even though we're in an industry, we're trying to make people better, unfortunately, certain times by contraindicated events, we may actually help the individual become worse and not better, which is a problem for us, but it's also a problem for the client, and obviously it's a problem for our reputation in the future. So hopefully the contraindications, the guidelines that allow us and ensure us that we are safe in our environment. So when we have to have a look at a few definitions regarding these contraindications, so if you ever hear or you read, or just in your own mind, if you have these bullet points either written down or you can memorize them with experience, it gives you an indication of where your client currently is. So if there's anything that's contraindicated, the sports massage practitioner, which is obviously yourself and myself, may worsen the client's condition through any assessment or treatment. If it's indicated, the assessment or treatment given by the sports massage practitioner will not aggravate the client's condition and may actually produce a healing effect. So these contraindicated or indicated words, terminology, will dictate whether we're going to help or we're going to hinder our client's progression. So when we are looking at the categories of contraindications, we need to look at these healthcare practitioners or healthcare professionals. So when we refer out to a healthcare professional, because we see that maybe our skills, or we see that something regarding the individual has ticked a few boxes that we hopefully want them to get ticked, we need to pass them on to experts that will be beyond our capabilities that allow them to be successful. So rather than just have a client and say, actually, yeah, there's something, I've got a tick here and I've got a tick there, and it doesn't matter, I just do it anyway. It's irresponsible on myself if I was particularly doing that, but it's irresponsible on the sports massage practitioner, because we need to steer our clients into the right directions to help their problem they currently have, to hopefully when they do come back to us as a sports massage practitioner, we can help and guide. So any healthy condition. Hi, so we got David as well. So hi David, are you okay? Hi David, can you hear me?
Hi David, can you hear me?
Hi David, can you hear me?
Stephen, I think he's trying to talk, but we can't hear him. David, can you hear us talking?
Oh, okay. Hi David, can you hear me at all? Yeah, no problem, David. Very much like myself today, computer for some reason, internet access was, yeah, a little bit slow, so it took me a little bit of time to come on as well. So I hope you can hear me. So if you can just give me a smiley face if you can hear me, David, all be great. Brilliant, superb. So what I'll do, David, Daniel's in the room as well, so he's participating in this course. What I'll do, I'll just go back a few slides because we haven't gone too far into it. So today's session, we're going to look at professional practice and sports massage. Have you got your books there at all, David, at all? Have you got your manuals with you? Brilliant. So if you've got your manuals with you, David, you can follow these PowerPoint lecture slides alongside your manuals. The PowerPoint lecture slides, like I said to Daniel earlier, is a good foundation. It gives us some really good insight to what's going to happen along the course, but also in this particular topic. But obviously your manuals have a little bit more in depth. So hopefully the foundation you put on today, you'll be able to understand certain terminology that will guide you into your manuals. So if you do have your manuals with you, on page 187 is where we're going to be looking at today. Brilliant. And also, David, if you do have your manuals, if you turn towards the back, there's a section which says Learner Achievement Portfolio, LAP. Okay, and if you can then guide yourself to page 13 on in your LAP, it will have some answers and questions section. So in all our modules, we need to fill out and finish some answers and questions that are dictated in our module. So altogether there are going to be 12 questions, okay, and there's a 33 total score. You need to get 23 marks to pass each worksheets. So hopefully you can have a look at those in your own time. But the quicker you can get those done, and hopefully some of this information, if not all this information, will be covered in an aspect within these PowerPoint presentations, and they're definitely going to be within your manual regarding professional practice. So the best way to do it is have a look at the questions as we go along. There may be some times though we actually do look at the questions, but if you feel you can start to fill them in quickly, brilliant, because the information you get from the PowerPoint slides and your manuals can be fresh in your memory, and then you just easily put the answers across. Because hopefully the quicker you get those done, the quicker you can email them or send them through to myself, and the quicker we can mark them and get them back to you, and that's one little section done, not to worry about in future. Can you give me a smiley face, David, if that makes sense to you? Superb. And like I said to Daniel earlier, if there's any time there's a question, any time that I may go too quickly for you, please ask the question, put a smiley face on, put the question in, and then we will go back. There's only 2 of you guys today, so we get a lot of interaction between all 3 of us, and hopefully by the end of this session we'll really get down to where we want to get to regarding the aims and objectives. So the aims and objectives, like I said earlier to Daniel today, is really to introduce the contraindicated sports massage, which are very, very important. Like I said to Daniel, sometimes these are overlooked a little bit, but these are our foundation. This is our Bible, really, because when we start to look at the contraindications or indications of our individual, by asking certain questions at certain times, it will give us an indication of whether we need to pass these individuals on to get better treatment elsewhere, or we're unable to then manipulate our skills or just manipulate the way we do things with our clients. So sometimes we cannot even carry out our sports massage techniques because there's too many things that unfortunately individuals taken with them, so we have to pass them on before they come back to us, and that's an important part. Professional practice is very, very important. So our learn objectives, by the end of today's session, you should be able to describe the contraindications of sports massage, describe the procedure to follow, and describe the procedure to follow upon the receipt of a referral client. So I need to understand what contraindications are. I need to then be able to then pass that person on if I see things a problem, and then what do I do when I have this person back? Does that make sense so far to you, both you guys? Little smiley face.
Thanks, Steve.
Superb, superb. So like we say, so we've only gone through a few slides with Daniel, so we can go back on those and recap those. So contraindications, amongst the most important responsibilities a sports massage practitioner holds is the knowledge of when to refer someone out to someone who's better qualified than we are, and how to ensure that they cannot worsen the client's condition with either inappropriate treatment or poor advice. So this is, I've said this a few times today, it's very important. If we find that we have something wrong with our clients regarding their health issues, then we need to be able to pass them on if we see that we haven't got the skills to correct that. And 99% of the time, when you look at your contraindications in your manuals, there'll be most of those we will not be able to cure right there and then, so we may have to pass them on to then get referral back. And then once we've got the referral back, we need to understand what the person's done, the treatment they've had, what the other person's recommended, etc., because that's going to give us feedback and give us a platform to what we're going to do as sports massage therapists, and predominantly what techniques we're going to use and how we're going to go about treating the case. So the contraindications are really our guidelines which ensure that everybody regarding myself, my client, my industry, but also other practitioners are helping this client to achieve the goals they came in for. So hopefully, I've gone on a bit of contraindications a few times, but hopefully we're starting to get the importance of how important it is to gain information. So like I said to Daniel earlier, when you read your manuals or read your books or you speak to other practitioners, there's always some terminology that comes up. So the contraindicated, so if you hear the word contraindicated, it means that you as a sports massage therapist may worsen the client's treatment during a condition because there's an underlying problem there. Indicated means the assessment or treatment given will not aggravate the client's condition and may actually promote a healing or recovery effect. Does that make sense to you guys? Little smiley faces. Brilliant. Superb. Yeah, brilliant. So these terminologies are going to be words that you're going to be using throughout your sports massage career. If you get into the mind that when you see somebody and you take information down, contraindicated or indicated, which one of these two people or this person automatically falls into. If it's contraindicated, okay, where do we pass this person on to? If it's indicated, yes, brilliant, we know that we're able to treat this person for the injuries or the post-injuries or pre-injuries or whatever the person comes in for the better. So there's a few more terminology, and this is going to relate a little bit in a minute to when you look at your manuals, if you have them, and start looking at the contraindicated individuals. So referral to another healthcare practitioner or healthcare professional. So any health condition which may require further investigation, you pass them on to another healthcare professional for assessment or treatment. Again, I've said this about 2 or 3 times before. It's very, very important. It's very important to also send this person to the right person. So it may not be your friend who has a qualification within there. You want to find the best individual that's possible to treat this client. Precautionary contraindication is when a health condition where a treatment should be adapted for safety or effectiveness. Client positioning, body area treated, pressure lubricant, and choice of technique. So when we are looking at our precautionary contraindications, is that yes, we've got our client back. Yes, hopefully they've achieved a slightly better base of health, but we're going to have to then start to say, well, what techniques do we do? There may be, for example, there could be a hamstring problem and there's still a little bit of tenderness in the hamstring. So how do we position our client to still get our effective hamstring massage, but how do we position them? They may not be able to lie on their back. They may not be able to put pressure on to start with. So that may be uncomfortable, so you may have to put them to the side, for example. So there's a different positions you might manipulate the body in to get the best result for the client. Also, different body parts being treated. There's certain body parts that are more sensitive than others. Everybody that we speak to, myself, you two guys, and all your clients that you have in the future, have certain body parts that they like or they don't like. But these body parts may be sensitive to touch. Which is a prime example for myself. I've had a few operations on my knee, more than I hope I ever did. But so certain times when my knee gets touched, it could be touching the table, it could be touching the floor, it could be touching another person. It's a little bit sensitive in certain areas. So we all come with certain parts of our body that are a little bit heightened through neurological input and maybe get a little bit sensitive in certain situations. Again, temperature regulations can be one of those that may aggravate a certain temperature. So we could be careful with that. How much pressure do we put onto the person? Which lubricant do we use? So silly things that we probably don't take for granted, but they're very important. How deep do we go with our massage techniques? Do we use thumbs? Do we use our, certain parts of our body that might give you more force through the body, which unfortunately that person, if it's sensitive or a very sensitive part of the body, may not can handle or may not like. Which lubricant do we use? Does the lubricant get dry too quickly, or does it stay in the skin for a little bit longer? There may be lubricants that are too mobile, so you can't get your hands in certain positions because your hands just slide. So again, all these precautionary contraindications are something which we, as an experienced practitioner, we start to find better ways to treat our individuals. Systemic contraindications is when a condition that affects the body system, implying that any treatment on any area of the body would negatively affect the client's health. So it's not just a case of, well, you've used my hamstrings needs a bit of tension, and I'm trying to work my hamstrings up it's not quite working, that hurts a little bit too much. Actually, it may be I'm massaging my left calf, but my right hamstring starts to be affected, because the whole system starts to be affected, not just one part. And you find that when individuals are coming to you with very sensitive skin, or very sensitive muscles, or a fascia system which is very, very tight in certain areas, controlling the body. So there may not just be effects of, yes, I'm working hamstring, oh, that's a little bit problematic, you're going a little bit too deep there, that's caused me a little bit of pain. I may be just massaging different parts of the body, and I'm still getting the effect of pain in other parts of the body, because my body is heightened and in a state of unfortunate disease or decay. Local contraindications is when a condition that is in a specific area and should be avoided, although treatment around the area may be beneficial. So like I say, when you look at your manuals, there may be some things contraindicated regarding boils or lumps or undiagnosed areas of redness or warmth, etc., that we may not be able to touch directly, but there may be certain parts around that area that we can play with, that we can massage, that hopefully will bring some relief to the part that's been a bit sensitive. There's a lot of information there, but is that a sort of following what you guys experienced before and sort of information that you've received previously?
Brilliant for Daniel.
Brilliant for Daniel, superb.
Yeah, we covered contraindications in the first day, and Wendy went through those as well, so that's great. But we didn't do it split into so many areas, so that's quite good as well.
Yeah, brilliant. Like, sports massage is a great topic. It takes a lot of physiology, it takes biomechanics, it takes psychology, and it sort of spreads them out a little bit. And we need to understand a little bit more in depth on certain parts, especially in this category of contraindications, and how they're just going to affect our client. You know, these are tools to us. Our hands are our tools that are going to manipulate the body. But these are our mental tools that we need to put individuals, when they come to us, into certain areas, saying, yes, we can do this. Actually, I may have to refer them. Actually, my precautionary contraindications, there may be sort of lubricants I've used with this person that actually doesn't work for the second person, or this person I use this body position to affect the body, but unfortunately I may have to change body position for somebody else. I may have to look at, you know, not even touching the body in certain areas because it's going to cause an effect somewhere else. But also there may be little parts of the body where I don't really want to touch because unfortunately there's something going not quite right there, but I can manipulate elsewhere. I can go above it or below it, or to the left or to the right, or to the opposite muscle. So really good indication of how you're going to affect your client. I know David has, but I don't think Daniel has. In your work manuals, on pages 189 of the professional practice in sports massage, there are a lot. I think off the top of my head, I'm counting as we speak now. 1, 2, 3, 4, 5, 6, 7, 8. So there's 8, 14, 15, 16, 17, 18, 19, 20, 22, 23, 24, 25, 26, 27, 28, 29, 31, 32 contraindicated areas. So for David, who has his manual, you can follow these quickly. But for Daniel, who hasn't, they will go from fractures, sprains and strains, inflammation, osteoporosis, down to multiple sclerosis, epilepsy, shingles, Parkinson's, hypertension, heart conditions, severe diabetes, etc., etc. There's a lot of indications there. Okay, the interesting factor when you start to look at indications, when Daniel looks at them later or David looks at them in a minute, is apart from having our obvious ones, sprains and strains. Yes, Daniel?
So the psychological contraindications, what do they come under?
I think this, regarding the psychological indicator, if I'm totally honest, I don't think there's too much in the manuals. I think it's something which, just from my own experience in the past, I think it's something to look into, especially when we talk about pressure, and when we're just talking about touch in general, because obviously some individuals are very open and receptive to somebody else putting hands on. Some individuals are quite timid and quite reluctant, and there will be certain body parts, like I say, that individuals like, and there's certain body parts individuals don't quite like. So I think the psychological element is just a little bit of, I don't think there's too much in the manuals. If I'm totally honest, I don't think there's anything in the manual. I don't think there's anything on the PowerPoint slides. If I go back a few slides, and if I also look at something regarding psychological intervention, I think the precautionary contraindications, when I'm actually trying to affect the individual. So again, client positioning, body area treated, pressure, all these different 3 elements are all going to affect the individuals, how they feel. So for example, an individual might be worried about their weight. So again, there may be certain positions which they're not comfortable sitting in because it may give them an appearance that they don't want to show. Body area as well, you know, some people might, for example, females, very close to the breast department, you've got to be very careful with how you're going to massage that. When you get to the buttocks, when you get maybe up into the groin, it's a bit areas up there. Again, some individuals will be happy because they understand that you maybe need to get to those areas to make the elements slightly better. But obviously, some individuals are not going to quite like going to those areas. So again, asking permission beforehand, can I touch you in certain areas if needs be, is very, very much needed. And again, pressure. Certain individuals will like certain pressure, and if you give certain individuals more pressure than needed, then psychologically they may be a little bit deactive and maybe not be so reactive in allowing you to continue with that massage. So your massage techniques that you know that you want to put across, you may not be able to put those across. So you may give the person what you think is a standard which is below what you want to, because you haven't covered all those barriers. So regarding psychological, there isn't nothing in there, but I think it's just in human nature. I think if you're talking to individuals, the way you speak, the language you use, the body language you portray is going to affect their perception of yourself, and especially when you do sports massage, because as soon as you start to touch people, obviously there's certain individuals, and there's certain individuals who will like that, and there's certain individuals that definitely won't like that. So I think it's just being cautious of how you as an individual, especially when you get hands-on, can affect an individual quite rapidly, turn them on to liking the situation or turn them off to not liking the situation. Does that answer your question, Daniel? Brilliant. Like I say, I think all these things are just experience. I think it's just knowing that on a one-on-one situation, you want to get the best treatment you can for the individual, but the way you carry it out is going to affect whether that individual allows you to be successful with them or not. That's like I say, when we go back to these contraindications, I think, like I say, fractures, sprains and strains, inflammation, I think, again, high blood pressure, low blood pressure, heart conditions, I think all these things are very universal, especially with the strains, sprains, fractures, etc. in sporting environments. So I think these are things are very universal, and if you've had a sports massage, these things come on your contraindication list. So your tick sheet that either you gain from an organisation or whether you design one yourself, these are common. However, the interesting fact when you start to look at all these contraindications that we are starting to go into things like osteoarthritis, multiple sclerosis, and rheumatoid arthritis, and ankylosing spondylitis, which is the crumbling of the vertebral column, Parkinson's disease, heart conditions, cancer, HIV and AIDS. So we are starting to look at some really health situations, things that unfortunately may never get better for the individual. So we really have to be careful when we start to look at individuals. And the last latter of things I said, from things like HIV all the way down to things like multiple sclerosis, unfortunately in this environment, individuals are becoming prone to these health conditions a lot greater than they were maybe 5 years, 10 years ago. So yes, you're going to get your clients that are trying to rehabilitate themselves from sport. Yes, you're going to get your clients who just like a massage, just to feel good about themselves, but you're going to get a lot of individuals who come from a health position which are definitely have to be referred on. It's definitely going to be under some doctor criteria, under some doctor information that you need to rely on, but also you need to continue a relationship with consistently over time, because these individuals will change, their health will change, and the doctor should inform yourself and vice versa of everything that's currently going on. So you have to have a very close relationship with a medical condition and a medical practitioner. So if you have your manuals, okay, like I say, I know Daniel hasn't and David has. They say it says task in pairs, which unfortunately, obviously, you guys are individual. So whether you do it now or you come back to it later on, hopefully this evening or sometime in the next few days. However, what I really would like you to do is that to get a grasp of how you're going to categorize individuals, or more importantly, how you're going to categorize health conditions, is to use the table. So in your manuals, you have, I think it's 3 or 4 pages, lots of contraindications. There's a lot of description type of what the indication is. There's a lot of recommendations, and there's possible consequences of treating that condition. So using your table, categorize the contraindication in the following manner. For example, the contraindication, condition, the category, and action to be taken. For example, high blood pressure, systematic, and GP referral. So if we go back, we look at high blood pressure. It's a condition that can affect the body system, implying that treatment in any area could negatively affect the client's health. In this scenario, we're talking about affecting the heart, the way the blood gets pumped around the body. So if we affect the leg, we're going to affect the heart. If we affect the arm, we're going to affect the heart, back, thigh, hamstring, etc. Because we're all trying to manipulate blood flow around the body as one of the main benefits of having a massage, especially having a touch on. As this blood flow gets pumped around, obviously it's going to affect our blood pressure, and obviously it's going to affect problems that may be occurring if you didn't know they were there, or certain medications may slowly, for that individual, lower the blood pressure, and you are then trying to increase that blood flow around the body. So again, there needs to be a good correlation with your current GP. So hopefully you would go through as many of those as you can, categorize them in certain areas, and that way, not just for the course, but especially for future, you can have a little list, keep it, so if someone comes to you with high blood pressure, you can know, you know what category they need to be in, and you know whether you're going to refer them straight away, or do you have a GP referral letter coming in to explain this individual's on medication A, medication B, or is under some other treatment. Does that make sense regarding this little task? It's a little smiley face, good for David. Daniel's good for smiley face or thumbs up. Brilliant. Like I say, there's a lot of work there, but it's definitely worthwhile because it's going to give you an insight to when to refer, when not to refer, and how that's going to affect your treatment with your clients. So when we are looking to refer anybody to a GP, hopefully it's a reliable GP, hopefully it's a person's current GP, because that way the GP knows the individual, knows their past history, knows exactly what the condition's about. However, GPs are not always fully aware of what sports massage treatment is about. Okay, so some doctors these days have a good indication of alternative type of medicine. I'm not saying sports massage is alternative, but it's in that world of non-medical. So a good relationship would be if your client comes to you and you find that there's a referral process you need to get to a GP, is to write out some information regarding what a sports massage practitioner does, what sort of indications that you can treat, how you go about treating that, because that way the information goes back to the GP, and the GP then may be happy to then refer back to yourself as some part of medical intervention. Does that make sense? I think going to a GP is not always the easiest thing in the world, especially with some sort of medical conditions, but the more information that GP can have, the more they're going to rely that person back to yourself, and you build up that relationship. Daniel, is that logistic to you? Cool. So again, there's a little task here. It says in pairs. So again, you can have this for yourself. So I'll give you maybe a 5-minute period just to sort of have a little think about a few things. There's a lot of information gone down there, but it may enable you to write something down, scribble it down. So someone who has come to you for a nice, calm, relaxation massage, but is taking medication for high blood pressure. What sort of things would you compose in a GP referral letter seeking improvement for your treatment? Because ultimately that's what you're trying to do. You're saying, this client's come to me, I've seen in your medical records you have a high blood pressure, and I see that you're under, let's say, Dr. X. Okay, so you're going to go back to that doctor regularly. But what I need to then somehow have some sort of relationship with that doctor, so the doctor's more than happy to refer you back to me for treatment. So what sort of things, Daniel and David, you can write it down in the little tick box at the bottom. What sort of things in your letter would you sort of say? What's the sort of outline? Maybe a couple of bullet points apiece. So I think David's writing something. So as a practitioner, as someone who is trying to gain business, but also reputation, and trying to help individuals, because that's what we're trying to do in this health-related issues. We're trying to help as many individuals as we can. So what sort of things would you want to put down to help? Yep, brilliant, superb. Yep, that's really, yep, well done. Yep, David, that's spot on. We need to explain what we're trying to achieve. We need to explain what we're about, our skills as a massage therapist, and how massage can help this individual alongside sometimes other interventions to achieve perfect balance, perfect equilibrium. And Daniel, yes, superb. What type of medication? Is there any areas to avoid? The more information we can get back from a third person regarding this individual, then the easier it is for us to write out, in theory, our program, write out our ethos of how we're going to make sports massage beneficial for this client. Yeah, brilliant again, Daniel. Any side effects or any medications? Because we need to understand, and that's a nice point to sort of to sidetrack on a little bit. That if we do have a GP referral to come back to us with a lot of medication on, we need to go and research that medication. We need to understand not as much detail as a doctor would, but we need to understand the basics of that medication, because again, that's going to affect the pressure, the position, the technique we're going to use with our client. So yeah, some really good points there. I think, does it make sense why going back to a GP if you need to, but also trying to give that GP as much information you can, especially if they're a little bit naive in what sports massage does, or they come from an attitude that they don't feel sports massage is important. Do you see how important it is really to then give the information of what you can do, how you can go about doing it, and all the information regarding benefits to the client? Does that make sense to you guys? Brilliant. I think it's very similar to a case study, and it is a case study basically. Personal training case study. Yep, definitely, Daniel. Could be an opportunity. There's unfortunately this day and age, in this environment in Western society, doctors are overwhelmed with. Yeah, brilliant. Yeah, good relationship, because doctors are overwhelmed with with a lot of patients coming in every day with all of these contraindications that are in your manual. And if that doctor starts to understand that sports massage is a very, very beneficial tool to enable for the individual to become healthier, to reduce any medical conditions that they currently have, but just become a better lifestyle, then hopefully they're going to refer you constantly. So you build up a nice relationship, they trust you, you trust them, they believe in what you're saying, you believe in what they're saying, and you build up this relationship to have a good referral process. And with the amount of contraindications in this manual, with the amount of doctors that are treating these contraindications, then definitely good relationship regarding referrals will constantly keep you in business, which as a sports massage therapist, unlike any other health-related professional, you're trying to build up a good practice. So yeah, some really, really good answers there. Hold on, I think it's starting to give that indication of you're trying to build up a case study. You try and build up as much information about the individual you can. Just like a personal training program, the more information you can have about the individual, the better your treatment's going to be. However, sometimes you're going to refer other than a GP. Okay, so there may be indications where you want to look at individuals who have maybe gait analysis that needs to be achieved because their gait is slightly off and certain muscles are being overactive constantly due to the poor mechanics of movement. In this case, let's say poor mechanics of walking. So your massage may give them short relief, it may give them a bit more temporary relief, but they're going to be walking around 10,000 times a day as recommended by the health authorities. And them 10,000 times a day, if the gait is not corrected appropriately for that individual, it's going to make that problem that you're treating constant, which is good for you as a referral process, but unfortunately it may lose a little bit credibility of your client because they're coming to you week in, week out for the same sort of massage techniques, for the same sort of areas being massaged, and they may lose a little bit of faith in you because they're thinking that you should be getting to the bottom of this, there may be problems, and it's maybe nothing to do with your massage techniques or the positions you choose or the depth or the pressure you go at. They're going to be doing things outside of your practice. They're going to be outside your 1 hour or 2 hour a week, and walking is one of the big things that people do constantly. So if we don't get the gait mechanics right, then we're going to have the same problems happen over and over again. So we may want to refer them out to someone who understands gait analysis, or someone who requires spinal manipulations, i.e. chiropractor or an osteopath down that route, because they're going to come back to you with a body that is better geared and in a better relationship to carry out activities from outside, and then you're going to help manipulate and keep the problem from occurring. So you may want to refer them out to other professionals. And it's also good because you build a network with people, just like you're trying to build a network with the GP referrals, you're trying to build a network with other conditions, because someone who manipulates a spine or goes through a gait analysis will correct that mechanical process in movement, but there's still going to be a tightness associated with past experience. So you can actually manipulate those tight experiences and make the individual become better. Their walk, their spine's going to be more mobile, but you produce a body which allows that mobility to be stable. So hopefully we can see now that yes, we've got the GP side of it, but also we've got the outside side, we've got the non-GP world. And the more we can build up a relationship with these guys as a sports massage therapist, we can get a lot of clientele, but also get our clients back healthy, which is what we really want to be doing. So learning outcomes for the end of this, so quite a short set of lectures, but hopefully if you can all each give me one of those three. So can you describe contraindications to sports massage, describe the procedure to follow when you have an indication, contraindication, and describe the procedure that follow-ups from a healthcare professional. So we're looking at describe contraindications, describe the procedure to follow when you have contraindications, and also describe the procedure to follow when referring to an exercise professional or healthcare professional, i.e. GP. So can you just literally have a little bit, give yourselves 3 or 4 minutes, and just, whether you post it through or you write on a bit of paper, just make sure that within your own understanding, you know how to describe these 3 different areas. If you're not too sure at any time, please just say it and we will go back on past lecture slides.
So I guess even a contraindication is a certain condition sort of beyond our scope of practice, which doesn't allow us to proceed with massage before we've referred to a health professional, basically.
Yeah, that's
a perfect answer.
Yeah,
we need to. Yep.
And these contraindications can be split into different categories, which we didn't know about. We covered on the practical day the contraindications, but not the categories. So,
okay.
I can't remember all the categories. It's systemic, local, I can't remember the other 2.
So I think those are the contraindication categories. So it's a healthcare practitioner, precautionary, systematic, and local.
Yeah.
Yeah, perfect. And I think, I think it's quite important to remember these, because it allows you then to put your condition into certain categories, which then takes you whether you need to go into the healthcare professional world or whether you go to an alternative professional.
Oh, right, okay. Okay, and then what was the second outcome? Can you move back to
the second outcome was describe the procedure to follow when presenting of a contraindication.
So would that be to write an official letter to the actual, or an email, I suppose a letter or an email, or an email with a letter attached to the health professional, describing who you are and what you do, and the benefits of sports massage and whether there's anything that needs to be avoided or whether it is possible?
Yes, yes, that's spot on, because obviously your clients coming to you, you have no indication of whether they are going to a GP until they give you some information. So the GP and yourself both have the best interest for this client. But unfortunately, yourself and the GP in this case don't quite know each other well enough, so you have to make a relationship, get communication, whether that's by phone, by face-to-face, holding a meeting, email, a letter, etc. Because you both want to be working on this individual from different parts, so you need to have that relationship to then pass information back or forth that allows the best benefits for our clients.
Brilliant. And I'm not so clear on the so I think Dave's got a question.
Yep, David, is there a question there, David?
Oh, no, that's right. No, so I'm just reading through Dave's writing. And the last one, after you follow them up and you've got you've got the approval from the alternative professional.
Yeah, I think the answer really to that one is when you start to actually practice your massage. Because you found out what was wrong with the individual, you passed them on or gained them back from a healthcare practitioner, and then we're going to look into the environment of, if I just go back a little bit, and then we're looking at precautionary contraindications. So, what body positions we're going to be using? What pressures we're going to be using? The choice of techniques we're going to be using. There may be some systematic conditions that we may, even though we're maybe getting benefit from a GP referral process from, let's say, high blood pressure, there still may be problems associated with if I'm going to touch the calf or the hamstring by inducing the excessive pressure due to the blood flow being magnified around the body. So there may be some systematic conditions there, even though that the individual's on certain medication to prevent from high pressure from happening, we may still be then aggravating a little bit more.
Yeah.
So again,
so I guess you should obviously check to see whether the massage session has aggravated anything at the end. Would you?
Yeah, I think you can't get better than asking the individual themselves, how do you feel after this session? If they come to you and say, actually, I feel warmer than I did before, I feel more relaxed than I did before, actually my hamstring on my left hand side is twitching and you've actually touched my right hand side. There's a lot of things that they can tell you, but also there's a lot of body language they're going to give you. If you touch certain areas, they might move their body away from you, they might make some little noises, they may sort of just try to close their eyes, clench their fists, pull their toes back. There's a lot of signs that an individual will give you that side.
Very similar to the
Which will tell you whether that, very much similar. Because that's their language. Not going to tell you straight away, but experience is the biggest key to this. You'll see things happen.
Brilliant. Okay, great. Thanks. That's me. I'm okay with those three now, I think.
Brilliant. David, how are you? Brilliant. Like I say, there's a lot of information that we've gone through in the last hour, but it's just very much similar to any case study you have, whether it's a personal training session or whether it's a massage session, is that you're just trying to get as much information you can. Unfortunately, with this massage, there's a lot more contraindications that you're going to have. Yes, you may even get those clients in personal training environments, but you probably have experience to say, actually, I can't deal with cancer. I haven't got the experience. I haven't got the technical ability. I haven't got the qualifications. Same with multiple sclerosis or cerebral palsy, etc. So we're common and we're very in tune to actually say, excuse me, we need to pass you on. But when it comes to sports massage, we're not thinking sometimes in the same terminology as when they're doing a personal training session. Yes, they're going to build up a sweat, their heart's going to run pump a little bit faster, they're going to get a bit of lactic acid at certain situations in their muscles, they're going to feel fatigued. That may affect their health-related conditions. But we're not really thinking that when we start putting hands on people, because we think we're going to calm the situation, where unfortunately sometimes you may aggravate the situation. Muscles will respond accordingly, whether they're happy or they're sad, in simplistic terms. And if the body's producing certain hormones at certain times, that's producing muscle activation without them actually carrying out muscle activity, then obviously we have problems if we start to put our hands on and throw blood around the system quickly. So hopefully in them few short slides we've got the basis. Like I say, the important thing is to have a look at the slides, have a look at your information that correlates back into your manuals, and see if we can start to fill out some of those worksheets. I think what we do, I think we have about a 10-minute break, take us to about 7 minutes break. I think we come back about 10 past, the last 20 minutes, and then hopefully we'll start to kick in a few of the other slides that are sort of associated with the precautions exercise. Is that okay with you guys?
That's fine with me, Stephen.
Brilliant.
Brilliant.
So what I'll do, hopefully, it's all new, so I'll put the timer on, so I'll start the timer. Let's do 7 minutes, give or take. And I'll leave the recording on. And then it starts going. So I'll see you guys in 7 minutes. Okay, David, are you back with us again? Little smiley face or a little tick in the box to say you're back. A few seconds to go. Brilliant. Daniel's unfortunately had to leave us, David, for a little bit, so it's just you and myself. So we've got 20 minutes left, and I think we're just going to go through the second part of this. Just a few more slides to go. As you can see, there's about 40 to go. There's associated conditions, and there's another little section area to it. But regarding this professional practice, I think looking at now the associated conditions, because it's going to carry on quite nicely from contraindicated conditions. So we're going to go through a few of these before 7:30, and then we're going to carry on those next week, and hopefully have a little bit of a recap of what we did today. So we're going to look at introducing conditions associated with sports massage, and hopefully by the end of this session you should be able to describe conditions associated with sports massage and describe the procedure to follow when presenting conditions associated with sports massage. So again, very similar to before. But when we start to look at associated conditions, we're just going to go back really. It's going to look at these GP referrals. So since a client may seek treatment prior to visiting the GP, early recognition of possible medical conditions is one of the most serious responsibilities of a sports massage practitioner. This is going to be really apparent when you start to do sports and activities and it's a live environment. So you could be alive at a rugby or a football match and you're working as a sports masseur. You see something go wrong, you're working on the pitch, you haven't got time there and then to go to get a GP referral. It's your expertise. You need to try to understand what may be occurring at that particular time. Maybe it's not what the injury was about or the mechanics of the injury, but more importantly, what's looking like a problem. Do I see things start to swell quickly? Is there a little bit of maybe possibly, unfortunately for some individuals, a bone piercing the skin? There may be some sort of indication where the person is showing you signs of discomfort. So it's good information that you need to really obtain instantaneously. So it's very, very vital for a sports massage practitioner to recognize that not all symptoms, which a client may be presently giving you, may be actually soft tissue problems. So there may be some neurological problems going on. There could be some bone, some skeletal problems within the breakage. There could be something going on that is a little bit deeper than just actually the soft tissue of the external skin, muscle, and fascia system. So if you are going to be working in those environments which require you to be instantaneously given feedback, as soon as you see something that you feel is not soft tissue in its nature, and that could be something neurological because there's something shaking, it could be a bone that's piercing the skin, we have to then allow for our expertise to pass this on and get medical conditions straight away. But we need to have information to us for our knowledge base that allows us to make those decisions quickly. Does that make sense, David, to you? Hopefully you'll be working with those individuals because it's a very nice environment to be in, but the instantaneous feedback that you need to give is very, very quick and very, very experienced in its nature. So does that make a little bit of sense to you, David? Superb, superb. So we are starting to look at some associated conditions. DVT, deep vein thrombosis. It's a condition that usually affects the calf, which causes the red blood cells to stick to the venous wall, forming a blood clot. And you tend to see this now when you go into altitude or plane journeys, is probably the one that is universal in people's understanding. You give certain socks, you give certain tightness in its tourniquet to allow for this blood clotting not to form. However, a strike in the wrong direction onto the calf can form these red blood cells sticking to the vein wall and causing this thrombosis, or this thrombus, which is the blood clotting. If it's left untreated, it can increase in size and preventing blood flow from that part of the body back to the heart and down again. So it actually locks it away from itself. So it's getting less oxygen in because it's got less oxygenated blood. It's carrying out its process under a very submaximal activity level, but the deoxygenated blood is staying there. The waste products have been built up through movement, and just for the byproducts of lactic, it's being associated with certain areas, and that is going to cause problems in the long term. We can't get oxygen in, we can't get oxygen out. Unfortunately, that part of the body, if it's down by the calf, can feed into having less function of the foot, and over time, if it's not treated, allows the foot, unfortunately, to carry out its activity in a very submaximal level, but also carry out less movement, and less movement will correlate to a stiffness in bones, stiffness in muscle, stiffness in fascia, which then unfortunately reduces even more oxygen going into the part of the body, and that in turn starts to feed away and produce a muscle which is dying slowly. Does that make sense, David? Most of the time, because it's all about this blood flow back to the heart. So when you are in an environment, I lift my hands up and I get this blood flow back to my heart quickly because gravity is forcing it down. Unfortunately, I have this pumping system in my body that pushes blood back to the heart. So I need this venous return to go quickly. Gravity is not being helped in my legs because it's got to go up. In my hands, I can lift my hands up and gravity is coming down. So I get this what's called blood pooling in my lower limb because I haven't got the pressure created inside to allow for the vacuum to be pushed up. And if I have this blockage there, which occurs very, very quickly, because it's a hard enough job for blood to be pumped up, so if I get a knock and the red blood cells stick to the vein wall, causing the clot, it's just like having a stone inside a hose. The water is being pumped through, but there's a blockage there somewhere. It can't come through. Less gravity is needed. No gravity, in fact, is actually occurring. It's just venous return for this pumping system. So the actual veins that start to pump start to become slower and slower and slower in its nature, and then it's going to be a hard job for that leg to then pump blood back up. That's why you raise the legs up and try to allow gravity to force it down. But unfortunately, these things occur quickly, and if there's a little bit of a blood flow and it constantly streams over time to a huge amount of lack of blood flow and oxygen intake and outtake, the leg becomes atrophied, and then from an atrophy position, unfortunately, we, as some individuals do, lose that part of the body because it becomes poison in its nature. And like I say, unfortunately, people have it amputated, which is a problem. So most of the time, yes, virtually all the time it's in your leg because it's the blood flow back to the heart is being disrupted. No gravity's forcing that. It's all a venal system. Does that answer your question? Brilliant. So we can help that. We've got this, you know, we take plane trips. We have a tourniquet on to allow this squeezing mechanism for blood to be pumped up. So we're trying to squeeze the blood up through our venal system. We can raise our legs above our head and let gravity help the blood come through to try to prevent these blood clots. However, if we do have red cells sticking to the vein wall and it's forming this blood clot, should any of this thrombus break off, it may travel through the circulatory system via this venous return and may become lodged in our heart. Sorry, in our heart, but it doesn't say that, but yeah, it may become lodged in our heart, also our lungs, also into our brain. So because we get the circulatory system up and blood's being pumped around our body, we've got this blood clot which has been pushed up. If it's not too big, if it's a massive blood clot, then unfortunately it's not going to go anywhere. But if it's a small blood clot and a little bit breaks off that big blood clot and this little piece is being pumped around, obviously it's going to go back to our heart, which can cause an aneurysm in our heart and a blockage, also going to our lungs, causing pulmonary distress, but also go straight to the brain because the brain requires oxygen and blood constantly throughout every single second of the day for life. So unfortunately, some people are training quite hard, don't realise they have deep vein thrombosis in the calf. A little bit breaks off due to the movement they're making, the position they're manipulating their muscle into, which is going to position and manipulate the bone, which then is going to manipulate the venal system. Slight wrong angle, pulls off this little bit of blood clot, and obviously the pressure's increased due to the activity you're carrying out and go straight to the brain, and as you see, some individuals unfortunately will collapse and unfortunately will cease to live. So hopefully deep vein thrombosis is very preventable, but secondly it has some major effects on the human body, and unfortunately sometimes death is one of them. So if you feel that you have deep vein thrombosis, some of the symptoms that you can get are aching or cramp, pain if you start to press, an edema, a swelling around the joint, distal to the area. So for example, if it's in my calf, distal further away, which would be my ankle, and increased pain in the calf on dorsiflexing, bringing the foot back. So I may feel an ache or cramp. I may feel, oh, that really hurts when I touch my calf. I may get swelling down below distal, which is the furthest part away from my calf, which would be down to the floor, in this case, my ankle. So my ankle might start to swell. Prox will be coming up into the knee. Increased pain when I start to then dorsiflex my foot, which I actually do when I go through a cycle of gates. I'll always go through dorsiflexion in gates. So does that make a little bit of sense to you, David, regarding what sort of symptoms can come quickly from a deep vein thrombosis condition? Brilliant. Like I say, as a sports massage therapist, you may position the foot into dorsiflexion to get a stretch on the gastrocnemius, which you may want to then manipulate around to break down adhesions. You may actually get pain when you start to do that. You may start to touch the calf in certain areas and the person doesn't quite like the pressure you're creating, even though you may not be creating any pressure. You may look at the foot and say, actually, the right foot's swelling a little bit. Again, you know, and it could be this aching or cramping, like even when you put the foot into dorsiflexion, they might just cramp up straight away. So again, it's all signs of deep vein thrombosis. It doesn't necessarily mean you have deep vein thrombosis, But there's a few signs and symptoms that in your mind you would just put down and go, there's a possibility. Have you had it checked out with a healthcare professional? Factors that which increase the risk of developing deep vein thrombosis, and as a sports massage practitioner you should be very alert of, which comes down again to your case study. When you ask your questions about your individual, you ask many questions from many different areas as you possibly can, because they will tell you whether they do some of these things or not. So are they having excessive bed rest? There could be a health-related issue. They could be fatigued quite a lot. There's certain health-related issues that cause you to be fatigued, so they might have that. They may have a previous injury which requires them to be in bed. Post-injury or surgery to the area. Have they had operations or have they previous injury to that part of the area? Are they obese? So again, excessive pressure on the circulatory system. The age, reduced activity, reduced mobilization of certain muscles and certain joints, muscle tone goes down, lack of blood flow needed in that area, lack of pressure being created. Is it a female who's on the contraceptive pill, previous history, or increased coagulation, i.e. raised clotting factors from the blood loss from like childbirth or even just an operation? So again, these are the things that we find as a sports massage therapist. We need to understand whether any of our clients have achieved any of these criteria. So, for example, prolonged inactivity. There may be a football player being injured, been in bed for 6 weeks because they've had an operation on their leg. Again, there could be some problems there in due course. Prolonged inactivity could be not be just bed rest, could be just lack of exercise due to obesity or due to age. So all of these things are starting to occur. So if we're coming from an obesity point of view, or an age point of view, or a drug like contraceptive pill, or just post-injury or inactivity, and obviously as we go up into altitude, we go into a plane and the pressure gets distributed differently, and obviously these individuals may have an effect of developing deep vein thrombosis quicker than somebody who doesn't show any of these problems or any of these factors. So last little few really on deep vein thrombosis before I think we finish off this session on this hour and a half. Is after checking for deep vein thrombosis and the risk factors, if still unsure, the following general guide can be used. Muscle aching due to indicated overuse. Massage is normally suitable. Muscles aching due, a little picture there, so due to overuse, for no apparent reason, suspect deep vein thrombosis. If in doubt, refer massaging to someone who has DVT, can have serious consequences. So if the muscle's aching due to an indicated overuse, so they're constantly doing the same activity over and over again, playing football, tennis, running, etc., then you could be pretty confident that it's just a muscle indicating of excessive tension being held in certain parts of the muscle that requires you to manipulate the knots and the trigger points out. If the muscle's aching due to the overuse or for no apparent reason, the muscle just aches for no apparent reason and they're not actually carrying out activities that you would induce overuse injuries, then you could suspect DVT. And if you're massaging someone who has DVT, there could be some serious consequences. And please refer them on to medical conditions, i.e. a medical practitioner, i.e. GP, for future and for current medical advice, because they will maybe give medication that you may need to know a little bit about before you then go on to massage this person with DVT. Does that make sense to you, David? I'm not too sure. I think it says here, if we go back one. Oh, sorry. Well, would it be okay, Swatho and Pill? I think as a practitioner, you need to cover all your bases, and you need to make sure that your questions you ask, whether you're writing them down as you go or you pre-plan them, can be taken back to a medical professional and be A, professional in their nature, B, correlate to the standards that you go with, so whatever massage practitioner, standardization company, organization that you get your insurance through, etc. These questions are applicable to those. As a practitioner, thirdly, you want to get as much information as you can to allow the best treatment. So I would say asking a question around is an individual on the pill, I think you may have to question it and structure it in a certain way that doesn't directly ask them the pill. But obviously when you look at individuals, especially from females to males, there's certain things that a female will go through for certain times in a month that a male will never go through, and these are going to have indications on how your contraindications are impacted. So from my experience, yes, I would definitely ask for those on the pill, but I would probably ask, are you taking any medication for that particular environment? Does that make sense to you, David? Yeah, I think if you, from my own experience, if you've asked a question, ask more questions, and if you feel you've asked too many questions, you probably haven't asked enough. And always ask open-ended questions, so you never just get a yes or a no. The open-ended question will give you an answer back that you can feed into another question. And you may not just go, are you on the pill? You might just say, are you taking any medication for childbirth, or are you taking any medication to prevent childbirth, or are you taking any medication that's related to a female condition or a female problem or female situation that's geared to your time for your menstrual cycle. So you may ask it in certain areas. Like I say, even for myself, saying it to you, it's not always the easiest thing to address, but just be aware that there are certain things that go on with a male to a female that will give you a good insight to whether you can actually massage that person at that current time. And yes, like I said to you, they're not always easy questions to ask. Like, I couldn't really get them out too quickly to you, but if you write them down, then you just follow those questions. Brilliant. Is there anything regarding today, David, for the last, I think you've been here now for literally an hour and a half, is there any questions you want answered? Is there anything you want to go back on for the last few minutes just to correlate and cement in your understanding of this particular topic regarding sports massage? I tend to use grapeseed mostly. I think it's, for myself anyway, it's each sports massage practitioner will have certain skills regarding what they feel they're comfortable with and what they're comfortable with. For example, myself as a sports massage practitioner, I go quite deep in certain areas. Where I know other sports massage practitioners are very superficial in their nature. They're a lot quicker sometimes with hands than I am. I'm a little bit more grabby, if that's the terminology, in that effect. I go a little bit deeper than others do. So for me, grapeseed oil is brilliant because it gives me enough lubrication on the skin, but it allows it not to dry out too quickly, but also allows me to go a little bit deeper within my technique. And other people sort of tend to use certain oils that allows them to move their hands around their body more quickly. So for me, grapeseed oil is great, but just practice. I think it's just practice with different oils and different individuals. But again, when you use a certain oil, you need to ask the individual, are they allergic to certain things that make up that oil? Because someone might be allergic to some parts of the grapeseed oil, and it may bring them out in a rash, or may bring them an allergic reaction. So even before you even use a particular oil, you may have different oils that you use for different individuals, because each individual's reactions are all slightly differently. So again, another good question to ask is, are you allergic to anything regarding content which is in grapeseed oil, maybe A, B, C, D content? Are you allergic to anything relating to those? If it's not, you may be able to use that. If they are, you may have to find an alternative. But I use grapeseed. It's a very, very universal, and it's a very easy oil to use. Does that answer your question, David? Brilliant. I think it's just practice. Just practice. Each individual will require different oils due to their, so like I say, due to whether they're allergic or they have a reaction to it. And different oils will give you different strengths regarding the pressure you use, whether you want to do quick massage or more depth massage, or different parts of the body will require you to maybe use different noise because some people might find certain noise sensitive to their parts of the body. Brilliant. Any other questions, David, regarding what you've learned tonight, or just anything regarding the course in general, regarding sports massage currently you're carrying out? Brilliant. Yeah, like I say, it's quite a lot to take in tonight. The great thing about these slides is that all the information is then back into your modules and back into your module handbook, and also all this information is then spoken again from when you do your practical elements of this course. So it all overlaps each other. Have a look at your module, have a look at the module handbook, and go through the bits that we've gone through today. That will cement and reinforce your knowledge and your learning. And also have a look at those worksheets that we spoke about earlier. It's page 13 in LAPs. It's a professional practice ones. The quicker you get those done and into myself, then quicker I can mark and get them back, and that's that part of the module, or that part of the section done. But also the information you've gained today, and then your module handbooks. Once you've read the questions, again, it will cement your knowledge even further. Yes, you can scan them to me, or you can just post them to me. I think I speak to you, Dave, anyway on email. I think you're one of my students that I look after by email and things like that. So if you drop me a quick email, I will email you my address, and you can just send them through to me anytime you see fit. Or yes, you can scan them through to me, put them onto email. Yes, I'll eventually need to see the real ones, but you can scan them and say, am I on the right lines? Am I on the right questions? Are they correlating to what you want to see in your answer papers? Brilliant, David. Like I say, anytime, please email me. You've got my email address. I'm fairly quick getting back to you quite quickly, so anything you need there, email, and I'll see you next Friday. No problem being late. I was the same thing today. I think it took me 40 minutes or so to get my laptop up. Must be something to the internet connection, but hey, you're here now, and you contributed to a great session. So have a great weekend, and I will speak to you next Friday, or not by email sooner. Thank you, David. Bye bye.